Welcome to the Better Birth podcast. Today I'm talking to Dr. Jenna Brough, who is a qualified clinical psychologist and a fellow hypnobirthing instructor. And we're going to be talking about birth trauma today. Welcome, Jenna.
Thank you for having me again, Erin. Yes, we need to talk about this.
We do, definitely. Considering so many people have traumatic births.
Yeah, they do. And
something people need to know about.
Everyone will see online sort of different percentages and how, anything more than zero is obviously a problem. But when we're looking at things, up to 45% of people will self-report that they found their experience of birth traumatic, to varying degrees, obviously, but that is just an awful statistic. And I don't know if you recall, but last year it was doing the rounds on social media where I think it was, I want to say a doula called Kathy, but I'm not definitely sure on that. I saw it via Beck Wallace Birthkeepers page, that someone had pulled up the war veteran statistics on PTSD or birth trauma or trauma, and compared them to birth, and said that people who are giving birth are more likely to experience trauma symptoms than someone who's been in active combat. Which is devastating.
That's horrific.
That we're in that position, that is what's happening to people giving birth in 2020, 2021, and it's increasing year on year, increasing. And whilst obviously we can make some sort of conclusions around why things may have got more difficult for birthing people over the last sort of 2 years, it was increasing pre-pandemic. So it's not, we can't just act like it's going to go away when and if the pandemic does. I'm aware that this podcast is going to go out in January. No idea where we'll be then. But yeah, it's just a huge amount of people are coming away having those experiences. And so we need to talk about it, because we need to understand why, so we can do things to prevent it. And that's a big part of what I want to work on moving forward. We need to support people that have been through it, and also share with other people who are going to come into contact with people who've been through those experiences. And I guess talking about and validating trauma and people's experiences is one of the things that I see happening a lot, which is good, on social media. Lots of people do the whole comparison thing, and they think about the sort of physical experience of birth and whether or not there was a lot of blood, gore, intervention, and comparing their experience to other people, and then sort of invalidating their own experience and thinking, well, it wasn't as bad as this, or it could have been worse, or I have no right to feel like this because I didn't have X, Y, or Z, and this person did, and they're fine. And we always compare with other people. It's sort of how we make sense of the world and how we better ourselves. But in this context, it stops people from reaching out for help. It stops people accepting how they feel, and fighting against it. So we need to sort of share and validate how and why people can experience birth trauma, I guess.
And it is so common. I mean, from my own personal experience, I can speak about postnatal depression and postnatal anxiety and birth trauma. But the number of people that contact me who want to do hypnobirthing courses, and probably the same with you, because they've had a traumatic first birth and they want to try and do everything they can to avoid that traumatic birth second time round. It's a really quite common trend, isn't it?
It is. And I'm so glad that you said experience of postnatal depression, anxiety, and birth trauma, because people often see these sort of different things as distinct from one another, or separate things. And whilst maybe medical professionals do see them and diagnose them separately, what often I see in practice, and what we understand, or I understand as a psychologist, is that often whilst someone may have a traumatic birth, they may not ever meet the criteria for a diagnosis of PTSD, it will manifest in other ways. So you may see things like low mood, postnatal depression, postnatal anxiety. So a lot of postnatal mental health problems and difficulties stem from birth trauma. It's not just PTSD, and it's not just severe. It's not just what people, I guess, would maybe understand as sort of the typical PTSD reaction in terms of flashbacks and nightmares and hypervigilance, being on edge. It can manifest in very different ways depending on the experience that the person's had, and then the knock-on impact that has on their sort of their fourth trimester, which is a stressful, difficult transition anyway. So yes, I'm really glad you sort of refer to all of those things, because yes, we're talking about birth trauma, but we're not just talking about PTSD as the outcome of that. We're talking about everything, the whole sort of postpartum well-being being affected, I guess, by a traumatic birth.
I think when people think about birth trauma, I mean, I personally, before I started working in birth, I did think birth trauma was that kind of PTSD kind of reaction to a traumatic event. I don't think people really realize or understand what postnatal anxiety is, for example. I know for sure I had postnatal anxiety after my second, and I know that is a direct effect of my first birth and having unresolved trauma, and it manifested in postnatal anxiety, which I still have now. And like I say, postnatal anxiety, my eldest is 9, I still have anxiety, and that's 100% from a birth that I had 9 years ago. So I think it is really important we talk about these things, because they can have far-reaching long-term impacts on somebody's mental health.
So I'm not going to go into a full-on history lesson about sort of PTSD and how it's been categorized or considered, but whilst it was at one time, obviously it was created on the back of war veterans coming back when experiencing flashbacks, all that sort of traditional stuff that people would associate with PTSD. Now that it's been much more generalized to include all sorts of different reactions and symptoms that manifest as a result of experiencing a traumatic event, and they sort of span feeling shut off, numb and disconnected. So you'd think depression, low mood, to feeling sort of on edge and anxious, and that generalizing to more than just any reminders of the traumatic event. It become your baby, and your parenting becomes an extension of you feeling like you need to control things because you worry that something's going to go wrong. And it depends on the situation. We're also in a place now, luckily, where sort of excessive guilt and shame and blame, self-blame, has been recognized as a symptom of the impact of a traumatic event. So where people blame themselves for what happened, or feel guilty, or trying to make sense of their responsibility within that event, and that has a massive impact on how people feel about themselves and how they feel about their ability to parent and their deservedness. So it is so wide and so varied, and has such a huge impact on people. And the thing that we need to think about is that quite a lot of this is preventable. I say unfortunately, but then I also say fortunately, because it means there's something we can do about it. We just need to get to a position where we are doing something about it, or we're able to. We're enabled to help. So much of it is preventable, and that's not me saying that the people who've experienced a trauma were able to prevent it. That's me saying the system can change. I say can change, could change, to prevent so much of this stuff, because of what we know about when people feel safe and when people don't, and the impact that has. And that's what it boils down to. So we're thinking about safety. That's the key. If if you want to find out if someone had a traumatic birth, the one question you would need to ask them is, did you feel safe? And if the answer is no, then the outcome is that their birth was a different experience to what it could have been. The trauma rates could be a lot lower. There are some, and we talk about this all the time in the birth world, medical emergencies, very, fewer than we're led to sort of, the data suggests, I guess. So there are a few medical emergencies where people's lives are actually at risk in birth. Birth is safe for a lot of people and their babies. But, in those situations, perhaps the trauma was unavoidable. There was a risk to life. There was a serious medical issue, and them or their baby, were at serious risk. So for those people, birth trauma, you could say, perhaps was inevitable. But for all of the others, which is a lot, there are things that could have been done that could have changed the outcome in terms of their experience, really, and it boils down to safety.
So what could people do then to kind of minimize the chances of that traumatic experience if they're pregnant?
So anything that the person can do to feel safer, and that's sort of on all different levels. So physically safe, emotionally safe, spiritually safe, psychologically safe. That's going to help, basically. So whether that is in the preparation and understanding what's going to happen, understanding how the system works and how the body works, both of those things, knowing what, being prepared and knowing what you're going into is always going to make you feel a bit safer, because it's fear of the unknown versus, everyone says that, don't they? When you have your first baby, it's fear of the unknown. When you have your second baby, it's fear of the known, which is a negative way of saying it, and they often relate that to pain and things like that. But anyone who's had more than one baby, you know what to expect, and generally most of the people that I've spoken to find it easier and feel more in control when, with knowing sort of what is roughly going to happen if their birth, didn't go completely away from sort of a natural progression, I guess. So it's knowing what to expect, or what you might expect in terms of how you might feel, and what the system that you're going to be birthing in, how they operate, I guess. So that's going to help you feel safer. We're obviously recording this on the day when lots of new changes have come back in terms of restricting birth partners, but having a team that make you feel safe, your birth team, and feeling safe is going to reduce birth trauma. That is why the continuity of carer initiative was developed, because knowing your midwife before you're in labour and meeting them for the first time is protective. You know them, they know you, they know what you like, what you don't like, even so much as being on first name terms with someone, remembering them when you're in labour, knowing who that person is who's on shift or who's working with you, is going to help you feel safer. Obviously we're in times where it's a lot less predictable, and we're restricted in terms of birth partners, which is why we're going to see an increase of birth trauma in the pandemic, and we have done. So yes, when and if birth partners and your healthcare providers who understand what your wishes, desires are, and who you are as a person is really helpful.
I guess one thing that you do have control over with the changing restrictions that we have at the minute is making sure that if you're only allowed one birth partner, they're really educated and that they understand what's going to happen and they understand how to support you, and getting them getting them, up to speed, whether that's doing a course or giving them a book or whatever it is that you are going to do to try and make sure that they are effective in supporting you so that you feel confident in them, I think is a really good idea.
Yeah. And because, I don't know if anyone is still doing continuity of care. It seems to have been one of the things that's fallen by the wayside. But yeah, if you only have control over one of members of your team, make a good choice and bring them with you so they can, be knowledgeable and understand what's going to happen to help you feel safe. And we always say this, I guess, in courses. You might plan for what you want their support to look like, and you might change your mind in labour, but as long as they know all the different things and what you might want and just what's going to happen and how to sort of, knowing that they know is the safety thing. Knowing that you can rely on that person in the room, it is the thing, the reason why we feel safe. So you can have some control over the environment that might make you feel safer. So I think a lot of people say, give birth where you feel safest. Do your research and give birth where you feel safest. And that can be in a hospital, if you feel that's the safest place for you, or at home or a birthing centre, when there's free choice. But yeah, it's about feeling safe for you. So yes, the stats do say home birth is safer than hospital for low risk birthing people, but you're not a statistic. You're a person, and for you, don't feel pressured to give birth at home if that's not where you feel safe.
Because if you don't feel safe and you have a home birth, it's not going to be conducive to the progression of labour, because when we talk about the production of hormones and all that kind of thing, you need to feel safe in your environment.
And I think the only reason why we as sort of birth educators talk about the fact that home birth is as safe or safer, sort of less risk of interventions and sort of negative outcomes, is because we're always led to believe that hospital is safer. We're not trying to persuade people who wouldn't feel safe at home to birth at home. We want people to feel safe, and we're just trying to support people to make that a balanced decision. So it's about you as a person feeling safe, not, well, I'll do this because that's what I've been told is safest. It's, what do you think? Where do you feel safest? And I think that's a big part of why many first-time parents do pick hospital, because they feel safer, because they've never given birth before and they have a huge amount of trust in the medical system. Now, that is obviously a different podcast topic. I'm sure you've had lots of chats about that. But yeah, I think that's why people default to the medical system with first births, because there's a sense that just in case protection, whether or not that's founded. It's obviously proven in research that home birth is safe, even for first-time parents. So it's about safety. And the reason why I think birth education does support that level of safety is because it gives people so much more than the system is able to. And this is not me saying, this is about time and pressure. So if you do your research and do a course, read a book, whatever, access the abundance of free stuff on the internet around knowing what's going to happen in labour, knowing what your options are, you're going to feel safer, because the NHS does not have the time to give you all of that information. That's a fact. It's strained, it's under strain, it's been under strain for years. Being educated, feeling like you know what you're going into. Obviously, no one can predict how birth goes, but knowing what might happen. So this is about, like, you advocated, don't you, plan A, plan B, plan C. Knowing what might happen and knowing that you've got some sense of control, and that's the other thing. So safety and feeling in control are the two biggest things. And feeling in control means knowing what's going to happen, but if anything changes, knowing that you one, understand that, and two, have a voice or a say in that. So what we know from research is that when people feel treated, this sounds like it should be something that happens without question, but it's clearly not. When people feel that they have been treated like a person rather than a patient, so like an actual human being with a name and preferences and wishes, and just as a person, which sounds so rudimentary and basic, doesn't it? When people have been treated as a person, as opposed to being treated as like a nameless, faceless patient on a conveyor belt, we've talked about this before, they are less likely to experience. So it's associated with lower levels of birth trauma. So being treated like a person, and that's all about the quality of the provider interaction as rated by the birthing person. And that's quite a strong association. We know that. And it sounds really basic, and it sounds like it's something that healthcare providers could do really easily. But we know strained systems, and we know staff pressures, and we know there's, we're at the minute we're wondering if staffing is safe, never mind optimum. We're in that situation. And yes, we can bash the system all day, and we can, we are doing things to try and change that, but we need to be realistic and support people that are going to be birthing in that system to know what is within their control and what isn't in their control. So the reason why some of the work I do is preventative, and I'm going to be doing some workshops for staff teams, is to try and help them to work with the little changes that are going to push people into having those more personal interactions. Very, very little minor things that get forgotten because staff are so stretched. But just linking the importance of those things. But at the minute, most of what we can control as birth workers, as birth educators, is what the birthing person's going in with, the tools, the knowledge, and the sense of safety, and feeling empowered, so they don't feel helpless. They don't feel like they were a bystander or a passive recipient of an healthcare experience. They're the person that's bringing the life into the world. And it's such a shame that we're talking about trying to get to a point where births aren't traumatic, as opposed to how we enhance already okay birth experiences. That's, the bar is so low. It's terrible, really, but that's the situation that we're in. So we have to go with it.
I do think that you're definitely right when you say that sense of control, and having that information so you feel like you're in control of the situation is a really key part, I think, of avoiding or minimizing the chances of birth trauma. From listening to all the birth stories that I've recorded on the podcast over the past 2 years, there has been a massive mix of different types of birth. And I very consciously chose lots of different types of birth stories, because I could just record loads of lovely, positive home water births, but that's not a true reflection of what positive birth is. And I've had, birth stories from people who had a planned home birth and ended up having an emergency C-section. Or like one of my clients, my all-time favorite birth story that I go on and on about all the time is my client's birth story, where she gave birth in Lewisham car park. And you tell people these birth stories, and people think, oh my God, that sounds so traumatic, that like she didn't make it into the hospital. And it could, you're right, it could be really traumatic. If you weren't prepared and you had this plan for giving birth in the hospital, when you end up giving birth in the car park, that could be really traumatic. But because she was educated and because she was prepared and she felt in control of the situation, you ask her, she'll say out of the 3 births she had, that was the most positive and empowering out of all of them. And it's because she was prepared and empowered and in control of the situation. The paramedic came running up to her and was like, oh my God, do you need help? And she's like, nope, I've got this, I'm fine. But she knew what was happening and she felt in control. And that's really key, I think, is that feeling of control.
And that's it. And that's the comparison thing, when people say, well, I can't have it, my birth definitely wasn't traumatic, or I shouldn't be feeling like this because I had something run of the mill or normal, or you know, there were no adverse outcomes and I was fine and baby was fine physically. And that's not what it's about. We know that there's no sort of, it's not, the association between intervention and birth trauma isn't as strong as the person's subjective felt experience. So we know that that is the biggest factor that contributes to birth trauma. So that's a good thing, because it means there's something you can do about it. Yes, there are unnecessary interventions. Yes, there's coercion. Yes, there's lack of informed consent. But if there's things that the person can do to try and sort of mitigate against those sort of things, then that's what we're here for, to try and empower them to get to that position. Whilst also, on the other hand, trying to educate and train and help the system to get back to some sort of semblance of being able to support birthing people in a way that I'm sure many of them want to. So interestingly, I wanted to add about people that have maybe experienced previous traumas. So people that have maybe had exposure to a previous traumatic event unrelated to birth. So I'm going to give an example of someone that I worked with a long time ago, and it's not related to, neither of the traumas were related to birth, but I just want to sort of illustrate how the brain works and why it's really important to consider that it may be something to be aware of, and even more of a reason to invest in birth education and prep. So I worked with someone who I was in an adult health service, and they were being treated for cancer, and they'd come to me as a psychologist experiencing PTSD symptoms. And what had happened was when they had their first sort of lots of injections and setting up the sort of chemotherapy rig, it triggered in their brain a 20-30 year old memory of when they had been restrained and injected because they were hysterical because their child had been killed. Awful situation. Their child had been unfortunately involved in an accident, and their child had died, and they were sort of restrained and sedated because they were so, obviously hysterical, responding to that news. And they'd never sort of processed that, they'd grieved, they thought they'd gotten over it, they thought they were fine. And then 30 years later, they were having treatment for cancer. And that process of being set up and injected, no one knows exactly what, obviously an injection was involved, but I'm pretty sure across their lifespan, they would have had other injections. But it was this injection they set up for being in a hospital and chemotherapy. And I don't know if they maybe restrain, they put something on the arm to sort of to keep it in, and it maybe had some semblance to being restrained. But yeah, they just became completely re-traumatized. So I think people need to be prepared. I mean, obviously you can't go throughout your life preparing for the fact that anything can trigger you, which is one of the things where we have a debate on social media about trigger warnings, because it's so individual to people. We don't know what's going to trigger people. And if we put trigger warnings on some things and not others, then we're invalidating the experiences of the people who are triggered by things that we don't warn of. So it's very much individual. But if someone's had a previous traumatic birth or a previous trauma, that involved them feeling out of control, helpless, scared, or their life was potentially at risk, it's often some sort of medical semblance, but not always. Then it's really important that they sort of enhance their level of feeling in control and supported. I mean, I know midwives ask, don't they? They always ask, have you had PTSD at your booking appointment and things like that. But not everyone knows that or recognizes that or connects to that. So it's so important that we support people to feel in control, that the system does, and that people take that opportunity themselves to not just walk into birth with that attitude of, I'll just go with the flow, or I'll see how it goes, or, I'll just trust that things will just happen. It's just, if possible, if at all possible, if you're pregnant and listening to this, and particularly maybe for the first time, just do anything you can to prepare, to be more prepared than you currently are, whatever that is, whatever your resources are, whatever that is, preparing. And this is not about, like you say, preparing with a specific one goal. It's not, this is the only way it's going to be, and if not, it's a catastrophe. We need to be flexible, but any level of preparation is going to give you a sense of control that's going to support you. And when we talk about that, having that one set idea or plan rather than multiple plans and sort of flexibility, we're also running the risk, if we do have that very specific idea, of then feeling guilt, shame, like shattering our expectations. So if we've planned and we've had this is where we run the risk of, if we visualize a particular birth, and that's the focus of our prep, and sometimes that's what's advocated, if you manifest it, it will come true. If you don't let anything else in your brain and you only visualize that birth, if that doesn't happen for whatever reason, because there are reasons that are outside of your control, and like we say, there are very few medical emergencies, then you're going to have shattered those expectations and you're going to feel bad. You might blame others and be angry, and that might be how it manifests. Or you might blame yourself and then feel guilt and feel shame. And it's a risk as well. I'm hopefully not making it sound more complex than
no, not at all. I think it's a common misconception with hypnobirthing as well, actually, that people think, or people that say they've done hypnobirthing and had a traumatic birth, I think, and we talk about this, not all courses are equal, not all birth prep is equal, and it's really important to research who's teaching you, and what the course content is, because a good antenatal and hypnobirthing course will prepare you for most eventualities. If they are coaching you to aim for purely a drug-free physiological birth, they are not preparing you adequately for birth, because they are only giving you one version of birth. And like you say, you are setting yourself up potentially for a traumatic experience, because if you were going to give birth in an ideal world, in a perfect world, in an environment where there are no external influences, and you have the most optimal birth environment, and you feel completely in control and feel completely confident in your body, then yes, you're probably going to achieve that kind of birth. But we are not living in a world that is like that, particularly right now. There are so many external influences that can influence or derail your plans, and you need to plan for XYZ, ABC, all these different types of things that can potentially happen.
And then interestingly, so we hear that a lot, but then I've also heard the opposite recently, where people have been saying, with birth education and hypnobirthing, does educating people about all these different eventualities make them more permissible? So like, does educating people about different plans and interventions and what they might be offered, does that socialize people to the medical model to the extent where it's more permissible, so people are more likely to go with it? And I'm thinking, well, if it's done well, if birth education is done well, I don't think that we're trying to groom people into any particular path. We're giving people information. Especially on a one-to-one, we're responding to what they say they want. We're giving them education to make decisions around what they might need, and then supporting them to make those decisions. And I think if anyone was to say, well, we shouldn't tell people about all eventualities and socialize them to the model, then we're not adequately preparing them either. We're not adequately preparing people. And in terms of control, I don't think that's helpful, really. So I think in terms of birth education, that's the way to go. Educate and support people, because the NHS doesn't have capacity to do that. Like, they don't have capacity to educate people about all the different things that might happen. And
or when you were just saying about are we grooming and so making these this medicalized version of birth more socially acceptable. I would argue that some of the antenatal education that you get from the hospital, controversially, potentially is doing that, because it can be a bit one-sided sometimes. And
and the language is also language which we talk about. So it's like, this will happen, and it's sometimes said you will be offered, but it's not often put as an offer, and it sort of seems like a specific timeline is dictated or suggested. But language is obviously really important in terms of control. Like, even if in a, I want to say, medical emergency, even when things are being offered, or even in a medical emergency, just telling the person what's happening, whether or not they've actually got a choice, is going to help them have some level of preparedness for what's going to happen in an emergency. So if it is an actual emergency and you need to do something, and in very, very, very rare circumstances, they wouldn't have time to discuss that with somebody, or offer choice. If that is the case, you can still tell them what's happening, even if it's as it's happening. We don't speak to you, we just wheel you off and do stuff. That's a really valid, as a person.
That's a really valid point, because I've seen lots of people who have been really traumatized in an emergency situation, and they had, they were given an episiotomy, or they had medical procedures done, and yes, it's an emergency, but the person supporting you can tell you, even if it's seconds before they do it, they can still tell you.
What we need to think of is, in those situations, there's a hell of a lot of people in the room usually. One of them can be by your ear telling you what's happening as it's happening. That is not beyond the realms of a possibility. And it's, I'm not bashing people for not thinking of this, because I know in the medical system, they're not trained to understand trauma. They're not trained to understand psychological preparedness. And it's also, I'm not being funny, but it's also not a priority. It's not. Because the priority is having mum and baby alive. And the psychological impact of what happens while they're trying to achieve that is secondary. It's not priority. But when they know that hopefully when they learn that they can do both, and just widen the lens a little bit, we'll hopefully see a little bit of difference, hopefully. So it's all to do with control, safety. I guess we've talked a lot about trauma, but and what to do to try and prevent it, but maybe we need to think about what happens for all of those people that have these traumatic births and want support.
Where can they go, and what can they do if they think that they have experienced birth trauma?
So I think with any trauma and with any distress, difficult emotion, the first thing that I would say is talking about it is important. Like, repressing it, shutting away from it, fighting against it, dismissing it is not going to help you process that in the first instance. So when people ask you how you are, talk about it. Like, it does often feel for new parents that everyone focuses on the baby and not the parent, and that is an issue. That's a societal issue. But if you feel you can find someone, or someone asks and you feel safe to talk about how you feel, how it was for you, because that is going to help your brain and your body process and move on from it. Hopefully you'll have some validation from that. Whether, now we've got social media, which is great because there's so much validation out there. For people who've been through similar experiences, people who once thought that they were the only person who had a certain experience can find like-minded people online, and that sort of peer support is really, really valuable, especially early on. So I'm going to mention now the Birth Trauma Association, which, if you haven't heard of, follow them. They're like the UK's leading birth trauma charity. And they actually have a phone line that's manned by volunteers, and also an email service, which is peer support emails. And also, which is really great, a partner peer support service. So for birth partners who've witnessed traumatic births or who have felt traumatized by witnessing a traumatic birth. So yeah, they've got all of those and they're all free. I mean, obviously they fundraise and, you know, you can donate, but the service is free. And yeah, so the Birth Trauma Association is a really good starting point for people. Even following the social media, you'll get validated for your experience, and you'll sort of not feel so alone. And then we can talk about NHS services as well, I guess. So it's a stepped care model in the NHS, whereby obviously you go in via your GP for most services, and then they will sort of screen what the issue is and how severe it is, and then they'll refer you on. Most often people will get them referred on to the next level of service, which is essentially like guided self-help. And it's got lots of different names now. It used to just be IAPT, so people may remember it as just IAPT, but now, because it's more of a business model, and some private providers now have those services, there are lots of different names, so that's a bit harder to explain to people. But yeah, you'll see things like time to talk, steps to change, IAPT, Horizon, sort of all sort of nice mental health related business names. And some of those are commissioned to treat birth trauma. So people who've experienced birth trauma and postnatal depression and postnatal anxiety. So that's sort of like the first step up from the GP. You can self-refer to them, because obviously GPs are busy, so you can self-refer to them. So if you sort of Google your local area, and Google psychological therapy is usually the term to use, and then you'll sort of find what that is and if they accept self-referrals. What we've recently been sort of establishing in the NHS is with new money, is new services called the maternal mental health services, or maternal mental health hubs. So to start with, that was money for just 20 pilot sites to work specifically with people who've experienced birth trauma or pregnancy loss, and also who have a fear of childbirth related to either a previous loss or a previous traumatic birth. So those services work specifically with those groups, but they're not as widely found. But again, if you contact your GP or you Google your local mental health trust, you'll usually find out what services they have in that area. Can we pause and I'll go boob?
Yeah, go for it.
Okay, I'm going to boob him. And then the step up from that is the perinatal mental health teams, which have, I guess, been around the longest for specific perinatal needs. So for people who are pregnant, or usually they have a criteria that they'll only see people for up to either a year or 2 years, depending on the service, after the birth that the issue is related to. But I guess it could be a grey area depending on if you've found multiple births traumatic, or if you've had multiple children, I guess. The perinatal mental health teams usually see the most complex issues, people who may require like psychotropic medication, so medication for depression or anxiety or other mental health problems during pregnancy, and people who are pregnant who've had previous mental health problems unrelated to the perinatal period. So they're, I guess, less likely to see people who have experienced a traumatic birth and have no other history of mental health need. But just to sort of give the full picture, I guess, of what the NHS offers. Obviously, the NHS is free to access, but one of the downsides there is obviously the waiting lists. So demand always outstrips the service provision. So waiting lists are an issue. And also, I guess, service criteria, because it's an NHS service. It's the way that the NHS works is often by having to put people into boxes. So having to define, like I've been talking about, severity of the problem, and some people might not meet threshold. That's one of the terms that you'll hear, or they don't. The reason why the maternal mental health hubs have been created is because there was quite a lot of people who fell through the gap in the middle. So they were too severe to see the first step, the first guided self-help type services, but they were not complex enough or severe enough to meet the criteria for the perinatal mental health team. So, and I just think there's so many people in that middle gap. This has been a long time coming, this new money, for this reason. So it's great, and hopefully the pilot sites will prove their worth, and there will be more money invested. I know it's one of the big things that came out of the previous budget around investment into perinatal mental health. So hopefully that will continue. I mean, like we talked about an idealized birthing world earlier, in an ideal world, we wouldn't need to treat so much of this. But again, the world that we live in at the moment. So it's a good thing in the context of the world we're in. And then the sort of, I've put it last because I know the main, I guess, thing that holds people back is the financial implications. But there are obviously private options for receiving support after a traumatic birth. I should probably add, when I talk about the private debriefs, I'll talk about the NHS debriefs as well. So one of the things that people might see offered is to have what's known as a debrief or a reflection session. These are typically offered by midwives. And the reason why they're typically offered by midwives is they usually can be helpful if people have questions about what happened, like they want to fill in the blanks, I guess, around their experience. So they've got some negative feelings about their birth, and they want to sort of talk through that with someone who might be able to fill in some of the gaps around sort of what actually happened, why things might have happened that way. So those sort of like unanswered questions are sitting uneasy with people. So, and that can be really validating to sort of, for things to make sense and sort of the puzzle pieces to fit together. So that's what people might see offered in terms of debriefs and reflections. So as I said, there's private providers who offer that, but the NHS does also offer birth reflections or birth debriefs, depending on where you are. It'll be called different things. And I guess there's pros and cons to both of those things. You are entitled to have access to your medical notes if you want a private debrief. Obviously, if you have an NHS debrief, you'll get access to your notes. Private providers will say that the way in which they're different to an NHS debrief is that they've got no ties to the trust, to the NHS service. So there's no potential conflict in terms of like alliance to the service or a need to remain not impartial, because I think people debriefing and support from a position as a psychologist, I think, no one ever actually knows what happened, and there needs to be some level of impartiality and just supporting people through. But yeah, they're not worried about litigation or admitting blame, responsibility, that sort of thing. So maybe it can feel a little bit easier. But I do know people that have had really positive experiences with NHS debriefs and reflections. It does vary, and it varies in every profession and service provided, the quality, I guess. So I'm not here to say that NHS debriefs are bad and private are good. They're different, and people have different experiences, I guess. If it's something that you think you might want to do, it might be worth finding out what other people in your area think of those services. But also being mindful of the fact that people rarely give normal reviews. They're usually extremely positive or extremely negative. So it usually cancels each other out. But trusted people, ask trusted people what they think about the service. So that's debriefs and reflections, which you can get on the NHS or private. If you have questions about what happened, why, and you just want to put those puzzle pieces together, and you think that might help you move forward. And then we're into the realms of what the NHS offers in their sort of maternal mental health hubs, guided self-helps and perinatal mental health teams from sort of psychologists and mental health trained nurses, and that's therapy. So In terms of therapy, obviously, I could talk about that all day because that's what I do. I'm a clinical psychologist and I offer that, but I'm not here to sell my services because I'm not going to be right for everybody. You know, in the same way that you said, you know, not all antenatal educators are the same, not all courses are the same. What I offer is not the same as what everyone else offers. So it's really about finding what you think is going to work for you. So I'm just going to give people, I guess, some general advice around what they might want to look out for when they're thinking about working through a traumatic birth with a private therapist, private psychologist. So we could look at the NICE guidance. And I know NICE guidance in the birth world often gets a bashing. And yeah, the quality is questionable in all different areas, but for a long time now, the two recommended therapies for trauma have been EMDR, which is eye movement desensitization reprocessing. It is a mouthful. I'm going to do a post about it soon, actually. I did one a while ago, but I'm going to break it down again. And then trauma focused CBT. So CBT does generally have a negative rap, I think, now. But trauma focused CBT, again, done well or done badly, but done well is quite different to CBT. And essentially they work on the premise that they're going to help you to process that trauma. So it no longer feels like it's something that's holding you back, that's something that's current. It's a past memory rather than a current distressing experience. And it helps you sort of separate out those negative emotions from the thoughts and sort of make sense of that and what happened, and how you feel, and enable you to move on. So, you know, you don't have to be a clinical psychologist to be trained in either of those models, but they're sort of things you could look out for. There are lots of other really helpful approaches for working with trauma. So I think compassion focused therapy is a really well evidenced therapy for working with guilt and shame, which comes after we've talked about trauma sometimes. But essentially what I would advocate, whoever you want to work with, whatever model, even if you don't really want to do the research into what model you think fits, a good therapist or a good psychologist should be able to support you to make that decision when you get in contact with them, or give you treatment options if they're trained in more than one. But what I would advocate people to do is to ask about people's training. Like, are you specifically trained in anything related to trauma? Another thing is, are you registered with any professional body? Like, who regulates your work? You know, so in the same way that anyone can call themselves a hypnobirthing instructor, whether or not they've done a course, and there are so many courses out there, it's very much similar for therapy. So, you know, anyone can call themselves a therapist, anyone can call themselves, actually, anyone can call themselves a psychologist. I think you have to have a degree in psychology, an undergraduate degree, but it's not regulated. That no one's going to come and imprison anyone for calling themselves a psychologist if they're not. So there are people that have got more experience, more qualifications, more training than other people. And on top of that, it's about the personal fit. Like if you find what that person is offering and how that person comes across, and you feel at ease with them, the therapeutic relationship is the most important thing. But I know that everyone can't afford to go and try out different therapists. That's what they say in America. Everyone has a therapist in America. It's much more normalized in America to have a therapist to sort of work through life stuff rather than having to go see them when something goes wrong, which is very different to how mental health is here. But people don't often have the disposable income to go and try out different therapists. And the main thing that I'm concerned about is people ensuring that they're protected. And from my profession, the way that we protect people is that we're registered with a body that makes sure that we do the training that we need to do, that we access the supervision and support that we need to be able to do our job well. And also we have insurance as well, to protect us if anything ever did go wrong. But hopefully those two things, our training and our support systems, mean that doesn't happen really. But yeah, so there's lots of different accredited bodies for different therapists and psychologists, and I'm going to put a post up about about that soon as well, because I could talk for hours about it. But just ask questions. You know, if you like the way that someone's presenting themselves on their website or on social media, you know, then inquire, so you know, you feel safe. Again, it's feeling safe with the therapist.
Yeah.
So that's the most important thing. I know that the Birth Trauma Association also has a direct, I don't know if they call it a directory or register, but that's for professionals who work in the area of birth trauma.
Mm-hmm.
I'm supposed to be applying to it. It's one of, you know, things drop off the end of the list. I need to put myself on the register. I'm not sure I think you have to send your qualifications in, but I'm not sure what they stipulate in terms of who they'll want on the register and who they don't want on the register, in terms of sort of what they do, what they offer, or what level of experience they've got. But the Birth Trauma Association is a legitimate charity, you know, the best charity that we've got for birth trauma in this country. So, you know, I trust their process. Yeah, so they're the options. And yeah, so it's as much of a minefield as it is for, there's so many options: free, paid, long waiting lists. I mean, I guess it's everywhere now, isn't it? It's the same as birth education. There's lots of different avenues for support. I know someone specifically asked a question, didn't they, Erin, about how to work through postpartum anxiety and postpartum depression without medication.
Yeah.
So all of those things are possibilities, all of those services. And I think because lots of anxiety and depression is underpinned by trauma, lots of those services should be appropriate depending on the level of need. But one of the things I wanted to advise, signpost people to, is and this will work for people and be a good option for people to pursue if they like reading, if they like self-help, if they're into sort of that sort of thing, because there's people that do and there's people that don't. And it's a book called someone called Michelle Cree, and it's called The Compassionate Mind Approach to Postnatal Depression. And I think it's like £13 online, an actual physical book. I don't think there's an ebook version. But yeah, and that's a good place to start for self-help. If you're not sure if you want to do compassion work, if you're not sure about, some people, even though the NHS is there and it's free, they're not sure about accessing that service. If they've had particularly traumatic experiences in the NHS, that can be off-putting. If they've had previously invalidating experiences of care. So I would recommend Michelle Cree's book, The Compassionate Mind Approach to Postnatal Depression. And it's like a workbook as well. So there's like activities to do and stuff like that. So it's sort of similar. I want to say similar. It's not the same, but similar to the sort of thing you would get in the sort of first level of self-help services in the NHS. And it's specifically written for postnatal depression. So yeah, I just wanted to mention that as well. It's hard when you're trying to cover everyone's budget, everyone's learning styles, everyone's needs. It's not possible, but we're getting there. I don't know how long this has been going on now. And I don't want to make it dry. So yeah, that is something I just wanted to recommend for that person, particularly if those service options don't sound like something they want to go for right now. In terms of the other question, about having a second baby after having a negative first experience, maternal mental health hub, I would say, would probably be the type of service that would hopefully meet that person's need if there's one in their area. But I think it's good to have that healthy level of skepticism about services generally, you know, going in naive, like we've said, our first births if anyone wants to go back and listen to the first podcast episode we recorded together. Naivety in first births, walking into it with just a sort of lackadaisical attitude to go with the flow, is not always helpful. You end up, you know, finding yourself in a situation that you definitely wouldn't be finding yourself in the second time round, or you'd wanting to be avoid, rather than not realizing you needed to avoid it in the first time. So healthy level of skepticism is good. And the way that the person worded it, they said, knowing that the hospital doesn't care. So that is, you know, do I really want to engage with them knowing that they don't care about me? And so if there is some processing to be done, then around how to feel psychologically safe, then therapy or maternal mental health hub. Otherwise, it's just about prep, education, empowerment. What have you learned from that experience? You know, that experience, you know, naivety is nobody's fault because nobody knew any different. But what do you know now that can put you in a better position next time? And, you know, empower yourself with everything that you can. The fact that they're on your page and they've asked you the question shows that they're in this community, so they can draw on all of that. And I think also, I don't know if the person's currently pregnant or if they're planning another pregnancy, but make the people this is not about dragging up the past. This is about making the people that are now going to be on your new birth team aware of why you've got those trust issues. Talk about it, you know, share it, because if they don't know, they might inadvertently trigger some stuff in you. They might not understand how that experience has changed you, and why. So, you know, even with the restrictions, you know, this isn't like a free pass, but I know of situations where people who are under mental health teams and are receiving perinatal mental health support, like, and in the same way as people with accessibility differences, they are afforded different support because it is necessary for them to engage with services. So that's something also to be aware of in terms of practical support.
That's a post actually I put on my Instagram.
Oh, did you, Brill?
This week about
if anyone wants to talk about anything, everyone's usually got a post about it. On fire.
It's around second birth partners, because I know that, well, my own trust that I'm chair for have just said that they're restricting down to one birth partner, but the AIMS website does have template letters, and you know, mental health is one valid reason to send that letter into the head of midwifery to ask for an exemption.
When I was recently at I'm not the chair of mine, but I was at my MVP meeting at the start of the month, and they were going to be on the agenda talking about going back up to 2, very slow, but in light of Omicron and another trust had just gone back down from 2 to 1, they said, well, we're not going to change it. So it's never been at 2 since the start, since it was ever first restricted. It's never been at 2, which is a shame. But yeah, those sort of exceptions are really important. And you know, everyone wants to argue why everyone should have that, but yeah, the exceptions are there. So yeah, if that's necessary.
And again, it's knowing that it's there, isn't it? It's knowledge. It all comes down to knowledge, you know, knowing what you can ask for, knowing what your rights are, knowing.
And I think the other thing is knowing that the first person you talk to might not know as much as you do. Like I've seen it where people have said, well, I've got you know, I'm allowed because I need this support person to support me, blah, blah, blah. And the person at the front desk or the front door or the first person they come across in the service has been like, blanket restriction, no exceptions. They might not know this rule because they're busy, because, I mean, it should, you know, I don't want to make excuses. It should be communicated. It should be common knowledge, but it's not. And so, you know, don't just accept that. That's when we go up higher, and when we sort of have to advocate for ourselves, and that's the empowerment of the knowledge, having the knowledge and being assertive and empowered to make it known that you know that this is what's necessary and that you're entitled to that, because you are like entitled to those adaptations. So yeah, so that's something to consider. I'm not sure specifically about that person's circumstances, so hopefully that's been helpful.
Yeah, definitely. Thank you, Jenna.
And then I think there was one more question. So someone who'd previously had a traumatic birth had asked how not to put pressure on themselves around trying to avoid not to have another one. So so I guess there's already that anticipatory anxiety there. And you know, that's why the birth prep and hypnobirthing is going to be more important. So I did a recent post about hyperarousal and how hypnobirthing tries to bring people's arousal levels back down into the safe zone, where they feel able to understand what's happening externally, understand what's happening internally in the body, and be able to make choices, and feel sort of connected to the experience, I guess, because that's really important in terms of feeling in control. And if this person's already anticipating worried about another traumatic birth, which it makes sense that they would be, then their baseline anxiety, their baseline arousal is going to be higher. So they need to make sure that they can stay in that window, that safe window. So birth prep, relaxation, hypnobirthing, all the tools that everyone gets taught on those courses anyway is going to be really more important to make sure that they stay there. If they feel like they're really worried about their previous birth and they haven't processed that, then maybe accessing one of the service or support options would be a good idea. I think maybe the peer support with a birth trauma association might be really good for that person, because they might be able to talk to people who've had a traumatic birth and then gone on to have a birth that they didn't experience as traumatic. And some people describe their subsequent births that aren't traumatic as healing births, and that's the process in itself. But talking to people and figuring out what your anxieties are specifically about may be really helpful. And I guess the main thing here is that it's that intolerance of uncertainty, which all humans have. We all struggle to tolerate things that we don't know, because this person doesn't know how their second birth or subsequent birth is going to go, and it's about learning to tolerate that uncertainty and not let it get in the way of one, enjoying this pregnancy if they're pregnant, and two, just living their life and accepting that this is a different experience. And obviously there's some data around sort of physical trauma and likelihood or not of a repeat in terms of sort of tearing and stuff biologically, but in terms of we know that the subjective experience, the felt experience, the psychological and emotional experiences sort of more associated with positive or negative births. They need to sort of let go, and mindfulness. So beyond birth prep, if birth prep and hypnobirthing does great things, but if it's just not quite hitting the spot, mindfulness and compassion focused exercises and relaxations, which you can get freely available on YouTube, could be really helpful for just sort of letting go of those thoughts and knowing that this is, once you've done everything you can in terms of prep and knowledge and putting everything in place, all the other worry and all the other anxiety is just unhelpful. But it keeps popping up. So it's about letting that go, and learning to do that. It is obviously easier said than done, but it's about learning to let go of that, and compassion based exercises around being kind to yourself, and also mindfulness exercises around living in the moment are really good for that. So yeah, and there's loads of all that sort of stuff online freely available. If self-help doesn't work, or you feel like the person feels like they want more support, then obviously all the options that I've talked about today are worth exploring as well.
Thank you so much, Jenna. I think this is going to be such an important episode for people to listen to, and you've crammed so much information in one podcast episode.
you know how on WhatsApp you can do *2 to make it go faster on voice notes. No one does that to me, because you wouldn't be able to listen to it. But I'm just wondering if there's a feature we can put on podcasts where it's like half speed.
Slow you down.
Half speed WhatsApp. I know you can speed up WhatsApp, but I'm wondering if you can half speed them, because I talk fast. I've got a baby as well, so we've had a boob break.
You had a boob break in the middle.
We had a boob break in the middle, so I'm sort of just constantly on. And we're sort of hurtling towards the end of the year, aren't we? So it's either all or nothing at the minute in terms of effort. So I apologize if it's been unhelpfully fast.
No, it's good. Where can everyone, I know I said this last time, but if they haven't listened to the first podcast episode with you, where can they find you online?
So I'm Tribe Psychology on Instagram and Facebook. And I think you can search for my actual name, so Dr Jenna Brough on Instagram, it will come up as well. And for anyone listening, any questions, I can't give obviously individual psychological advice in the DMs, but any questions generally about services, signposting, or what to Google, just to get in touch. And I will be offering preventative and responsive work for birth trauma moving forward. So hopefully we can make progress at both ends, and reduce those numbers, because not me on my own, obviously. I have you know, there's a whole load of people who love doing this work because it's so needed. And most hypnobirthing instructors and birth educators, I mean, it's the biggest thing, isn't it?
Yeah.
We're trying to prevent, you know, like you say, maternity staff, they're focused on preventing the negative physical outcomes.
Yeah.
Most birth educators and antenatal educators obviously want to prevent the negative physical outcomes, but we're here for the parents and the psychological stuff. So yes, which is why this community is amazing, because we've got such a good group of people that are working at all different angles for everyone. And and hopefully this episode has just validated experience and given people some helpful information around what they might be able to access to give them support at a range of different levels and budgets. And
thank you so much, Jen. I really appreciate your time. And I really do hope that people seek you out online, because you're amazing and you are an absolute font of knowledge.
I'm just going to write down now, EMDR post, because this is the life. To-do lists always. I'm just going to write down which post I said during this podcast. I'm going to have to listen to it and be like, yes, I'd have to do a post about that. I don't have content strategy pillars, Faye. I need to get my organised birthday babes.
Oh dear. Well, have a lovely Christmas.
Yes, you too. And I'll speak to you soon, of course. And thank you for having me again.
Oh, you're so welcome. Take care.
Bye.
Bye.